oxygen level and higher blood enzyme. He passed away yesterday. Another is 72-year-old male with hypertension, a history of stroke and diabetes, and also a muscular atrophy. And then on the 27th, he was admitted because of pancreatitis. And on the 26th, he tested positive with PCR with CD value of over 30. We believe he got the disease outside the hospital. On the 23rd of August, he passed away. The third is a 77-year-old male with no vaccination record. He had hypertension, coronary heart disease, cancer, and also a fibrillation, atrial fibrillation. And then he tested positive on 10th of August. On the 13th, he had a consultation. On the 20th, he attended in the Department Intensive Hospital. He presented with fever and cough, and he showed pneumonia in his X-ray and tested positive. He was admitted to Park Hoi Hospital. His condition deteriorated and he passed away on the 21st. And the third is a 92-year-old female with 3 jabs living in a care home. She had a heart disease and also a background of heart failure. On the 14th of August, he attended in the Department of Jungle Hospital. She had poor eating, no fever. In end of July, because of COVID, he was admitted and has since recovered. During his hospitalization, no PCR positive tested. He passed away, and we believe that death had nothing to do with COVID. And the third is a 63-year male with diabetes and histories of a number of strokes. On the 29th of August, he attended in the Department of Prince of Wales Hospital because of general weakness and pneumonia, signs of pneumonia, according to chest X-ray. On the 18th of August, he did RAT, tested positive, and he required half of oxygen when he attended in the department. His condition continued to deteriorate after admission, and he passed away on the 21st of August. 188 patients have since recovered. 150 have been discharged. 8 tested positive via admission screening, and 12 patients are listed as close contacts. Another 135 staff members confirmed. 53 more employees have returned to their duties. Now I'd like to talk about the male medical ward of PWH, an 82-year-old male. On the 19th of August, he was tested positive via admission screening. We conducted contact tracing, and 3 aged between 83 or so, and 4 staff members confirmed. We are doing contact tracing. 4 patients are in isolation treatment, condition stable, and so are the staff members. We have stopped admission of patients into that ward, and the ward will be disinfected. We will closely monitor the conditions of patients because the situation remains serious and more patients required inpatient treatment. We have 2,100 patients in treatments. For those who are critical or serious, the number is also rising. Many patients require oxygen and also respirator. We have got a chart distributed to you. Starting from early August, you can see that the number of patients requiring oxygen and respirators have been rising gradually, and this has caused pressure on hospitals. So worried about children. Those requiring hospital treatment under 11 are rising. As last night, we had 135 of them. Hospitals have to redeploy beds to receive COVID patients, and AW COVID treatment center will be mobilized tonight, and we will activate 200 beds as a start. We're going to redeploy 100 staff members and allied professionals to receive the following types of patients: confirmed elderly patients with no family to take care of them, more complicated cases in Penny's Bay Center and stable patients from public hospitals will remain flexible, and we will adjust our services accordingly. If there are more inpatients, then we have to activate our phase 3 bed mobilization, and non-essential services such as elective operations and non-urgent treatment and day services will be cut. I ask for your understanding. We need to cut non-urgent services before we can mobilize beds and staff to treat COVID patients. So if you haven't been fully vaccinated, do so as soon as possible, because it takes time for antibodies to be generated, and you should be fully vaccinated to protect yourself and also people around you. For high-risk persons, in particular those who are 60, please, if you are confirmed, see a doctor as soon as possible and start taking oral drugs as soon as possible to lower effectively the risk of serious conditions and even fatalities. Well, on the 21st of August, I'd like to report to you the latest situation of yesterday. Yesterday, we had 6,380 new cases, a record high in recent days. Among the 6,380 local cases, 2,236 cases were PCR tested positive, 4,144 via RAT and confirmed by PCR. Yesterday, we had 237 imported cases, 203 tested positive by PCR, 34 imported cases positive through RAT. As said by Dr. Lee, we had 5 more deaths yesterday. In the 5th wave, so far, we have got 9,397 death cases. Among the 237 imported cases, 104 were picked up at the airport, 23 at quarantine hotels or quarantine hotels, and the remaining 110 were picked up at community testing centers. 89 were samples taken on days 4 to 7. The remaining 21 samples taken after the day 7, and this with high CT values. So I believe most of them are positive cases. Cases were imported from 42 countries or places. 9 have imported more than 10 cases: UK, Thailand, US, India, the Philippines, Canada, South Korea, Australia, and Singapore. The remaining 33 places have imported less than 10 cases. And for care homes, yesterday we recorded 13 care homes with new cases, including 7 care homes for the elderly, involving 9 residents, and 6 care homes for the disabled, involving 12 residents and 2 staff members. Among the 13 care homes, 100 residents are listed as close contacts and require quarantine at AWE.
In the 13 homes, they are in Sham Shui Po, where there's 1 resident tested positive. There's another one in Sha Tin Tong Group of Hospitals, Mok Wong Fong Yi Elderly Home for the Elderly. 1 resident tested positive, and there's 1 in Chun Wan Chun Lok Home for the Elderly. 2 residents tested positive. In the Northern District, Luen Wo Center for the Elderly, 1 resident tested positive. In Tuen Mun, there's a home, the Yan On Home for the Elderly, 1 resident tested positive. In Wong Tai Sin, there's the home called Choi Wan Koi Home for the Elderly, 2 residents tested positive. The last one is in Sham Shui Po, Ying Shan Bui Home, 1 resident tested positive. There are also 6 homes for the mentally handicapped where there are cases, including 1 actually called Choi Lam Home, where 1 resident tested positive. And also in Eastern District, there's 1 home where 1 resident tested positive. In Kwun Tong, the Hong Kong home, there's 1 resident tested positive. In Cheng Yi Baptist Oikun Social Service Yan Kwan Home for the Disabled, 1 resident tested positive. In Eastern District, there's a Fu Hong Society home, 8 residents and 1 staff member tested positive. There's another one in Wong Tai Shin, run by the Hong Kong Society for Mental Health, one resident tested positive. And there's one home which was said to have a large cluster. It's run by the Fu Hong Society, and it has 50 residents and 38 staff members, occupying 2 stories. The first case appeared among a staff member on the 3rd story. She had 3 jabs, but days earlier she had a runny nose. Initial test results were negative. She continued to report to work, but on August 18, she had a night duty, and August 19 she left the home. On August 18, as a result of regular PCR test, results came back positive, and the CT value was a bit low, which means high viral load, CT value 13. And before she went to home, she went to work on August 18, RT test came back negative. And we carry out tracing of close contacts by yesterday. 8 residents tested positive on RT. They were all on the 3rd floor. So we arranged for all other residents on the same floor to be quarantined, altogether 16 residents. And also to update on the previous case of the cluster at home, announced on August 19, a home for the elderly in Qingyi. 12 residents and 5 staff members were involved. There are about 100 residents actually were sent to HOR Expo as close contacts. Among them, during the quarantine period, 9 cases tested positive, and the 5 staff members also tested positive. So for that particular home, of the 112 residents, 21 positive cases were found, and of the 63 staff members, there were 10 positive cases. So far, we recorded 58 homes with infection cases. They include 13 homes for the elderly and 22 homes for the disabled. Altogether, they involve 130 cases. 108 were residents and 22 were staff members. The 58 cases of homes with infection in a week compared to previous figures, and also in the preceding 6 weeks, with a daily average of 22 cases involving homes, it shows an was infected, and the teacher teaching the class is also infected. The fourth school is in Tuen Mun, an international kindergarten. In the K2A class of 19 students in the class, one student is infected. Sorry, 2 students are infected, and 1 teacher is infected. And then in the Eastern District, a Montessori school in Taiwan, K1 to 3 groups, 13 students, among them 2 students and 2 teachers are infected. In Wan Chai, the St. Paul's kindergarten, in a class of 31 students, 3 students tested positive. The last school is in Kowloon City, Stanford American School, Hong Kong. In 7R and R class, of the 18 students, 2 tested positive. The variant of the virus, the genetic analysis carried out yesterday of all the samples tested, samples with L452R, proportion of cases with that was 34.1%, and I believe they are of the BA.5 subvariant, so similar to previous discovery. I also like to remind the public that they must comply with the isolation and quarantine requirements. All the confirmed cases should comply with the quarantine order, and their family members who are close contacts should comply with the quarantine order as well.
The public should comply with the relevant regulations, and the administration will follow up violations very strictly. And the government has also required all confirmed cases isolated at home to wear the electronic wristband, and they must not leave home. And if confirmed case is left home, doesn't comply with the requirements, have not worn the wristband, or has carried apart, or has not turned on the Stay Home Safe app, then is a violation of the isolation order and can be subject to a fine of $10,000 and imprisonment for 6 months or for 1 month. Since the outbreak under Cap 599, the administration has enacted a series of regulations. As the 20th of August, the Department of Health has followed up on 200 cases involving 260 persons. They have been convicted by court. Some have been jailed for 4 months and then fined up to $15,000. There are about 600 cases that have suspected to violate the related regulations. 140 related to the wearing of electronic wristband and suspect a violation of isolation order. The Department of Health will follow up on each and every case very seriously, and based on investigation and evidence will consider prosecution. I appeal to the public to follow all the compulsory testing orders and notices under Cap 599 and be tested. For those who violate the orders, he commits an offense, and violation or conviction can lead to a fine of $25,000 and imprisonment up to 6 months. For those who are under order, they must comply with the compulsory testing order at once. A violation can lead to a fine of $50,000 and imprisonment of 6 months. So far, the department has already issued over 25,000 compulsory testing notices, and over 7,000 summonses have been issued. Relevant government departments, when members of the public want to enter designated premises, will take very strict enforcement action, including those with the red code or an amber code. So I appeal to the public's cooperation. We now open the floor to questions. Please use our microphone and identify yourselves before you ask questions. I'm from Phoenix TV. Now for AWE, you are going to admit 200 patients. Will the departments have sufficient staff? If further beds are activated, do you have any plan to man the beds? And we understand that halls 1 and 2 are taken up for other activities. So if the situation continues to worsen, will you activate halls 1 and 2 as well? Now, in halls 8 and 10, we are going to operate 200 beds. Hopefully, with these 200 beds and ICC of Northland Town Hospital, there can be synergy. We will relieve the pressure on hospitals and also elderly admissions from the community as far as possible. For halls 8 and 10, when necessary, we can increase the number of beds to 500. And we do have plans to deploy manpower. Well, during the peak of the 5th wave, we had manpower plan to take care of elderly patients and elderly patients of poor mobility. Now, we have maintained liaison with AWE. If necessary, we can use other venues to enhance our capacity for admitting patients. This lady here. I'm from Now TV. Now we see that there are positive cases reported by care homes for the disabled. Can you brief us on the reasons for the outbreak? Is it because they have not worn face masks or because they were eating together? Now we have we've got more than 6,000 cases on a daily basis. Do you expect a further rising trend? Now, for outbreaks in care homes for the disabled, this is a bit different from the situation for elderly care homes. Now, for elderly care homes, residents rarely go out, and visitations are also limited and under very stringent conditions. So, in care homes, or when there are cases, usually it will be due to confirmed staff members spreading virus to elderly residents. But for elderly care homes for the disabled, some of them allow their residents to go out and even to work outside, and that brings the risk of infection in the community. So there's the possibility of residents being affected when they are in the community. And the second possible channel of infection is from confirmed staff members. They may be asymptomatic or their RET may be negative. During the infectious period, they might have spread the virus to residents, in particular to those who are bedridden or require close attention and care. And usually, in a residential environment, the residents may not wear their face masks properly or may be not throughout the day. So once the virus has found its way into a care home, then the risk of spreading is high. It's just like a domestic situation. Now, for 4 days in a row, the number of local cases have been over 6,000 per day. So it has picked up a rising trend. And this is worrying. This goes to show that we have a number of transmission chains in the community, and transmission is rising. I hope the public can follow all the anti-infection control measures, in particular when you are in a crowd or gatherings. Please wear tightly fit face masks such as NF95. And for those who are not yet vaccinated, please do so as soon as possible to boost immunity. In case the situation continues, and if you are infected, you can lower your chance of hospitalization or even death. Next. The lady on the right. I'm from Cable. As said, in care homes for the elderly, usually the virus comes from staff members. will you advise that more frequent PCR tests be done, and how frequently? And for those who require oxygen and ventilators, the number is rising. Do you have sufficient equipment to meet the demand? Do you have a certain threshold for the use of such equipment? Now, for testing requirements of staff of care homes, currently, staff members are required to do a weekly PCR and daily RAT. Of course, RAT is not as sensitive as PCR, but then it is convenient and results can be known immediately. So it is useful in preventing positive cases from going into care homes, or to allow staff members with the virus to report duty. But then it's not as sensitive as a PCR. We've seen cases from PCR positive cases with RAT negative results. For instance, in care home I just talked about now, there was a staff member with mild symptoms, RAT test negative. The case reported duty, but then PCR result was positive, and the CT value was low, meaning a high viral load, because staff have to be in contact of high-risk clients, and these are people who are likely to have complications once infected. So these staff members should protect themselves, and also residents. We advise regular PCR as regards how frequent, at least once or twice per week, because Omicron has a short incubation period. If tests are not frequent enough, then it may easily escape the incubation period. So we suggest that staff conduct regular PCR tests.
On the use of ventilators and oxygenation, it shows that more and more people have been infected. Now we are on stage 2. Let me stress that right now, hospital authority places much importance on, our flexible deployment of staff, and also use of medical equipment, and also deployment of medical wards. We have got actually preconceived plans. If there's a need, should the number of cases continue to rise, then we'll enter phase 3 of our plan, but which means that the more non-emergency services will have to be affected. Next one. AM730. I would like to ask about, like you mentioned that you said it's mainly staff members who cause the clusters at homes for the elderly. Do you have figures of the cases which actually are triggered by residents or people visiting them? And you find out of the cases among imported cases which were discovered on the 4th to 7th day, they number 37. Is this figure within your expectation? Are you expecting that some imported cases, have been found through RAT on the 4th to 7 days? And of the 135 cases involving children, they are concentrated in the North Lantau Hospital Center for Control of Infectious Diseases. Can you give more details? And also, have you already decided on how many patients to be transferred to Asia Works Book? Firstly, on the residents infected at residential care homes, of the cases announced today, of the more than 11 cases announced today, we have seen that cases where only the residents are infected but no staff members are infected. So for staff members which carry RAT every day, and for these homes, and when the residents turn out to be infected, the homes will report those cases to us. So we receive reports every day. For some cases, we only found that only residents are infected, and we don't know amongst them what are their sources of infection, and they have not been out of the homes for elderly, and some are even bedridden. Some may have been out for follow-up medical consultation or for home visits, but they are a small number, a very small number. And for residential care homes for the elderly, for residents' infection, often we cannot determine the source of infection. We can only carry out random tests and to arrange for all the staff members and residents to go for a PCR test. And then through the PCR test, we can identify more cases among residents and staff members. On the other hand, since staff members do RAT every day, even if there are cases involving residents, often these resident cases are discovered at an early stage, and their fellow residents will be quarantined as early as possible, so there's no major outbreaks. But this week, we have seen that homes with more than 5 cases actually have grown in numbers. So there are more of such homes. And as for imported cases, every day we announce the figure. Every day the number of imported cases actually fluctuates from time to time. We would accumulate more data to review again the current situation. Cases found to be positive during tests on the 4 to 7 days. There are more. The numbers has increased, but they tend to make up 20 to 30% of the overall confirmations. But we need to accumulate more figure over a longer period of time before we can do a proper analysis. Right now, we are actually stepping up the frequency of doing PCR tests. Earlier on, we carry it out on the 3rd and days later, but now we are now doing it within the 7-day period on the 4th and 6th day. So maybe there could be some relapse cases that occurred which were found through PCR tests. Of the 135 patients in the pediatric ward, they are distributed in various pediatric wards under HA. A small number will be in the North Lantau Infectious Disease Control Center, because for the patients which are stable and accompanied by adults, they will be there being treated. For some child patients, they need to be handled in the hospital environment, so we want to vacate more beds in hospitals for needy child patients, and so we have tried to add more patients at the Asia World Expo to ease the pressure on hospitals. For the Asia World Expo Center, which begins operating this evening, we have no fixed quota on the patients to be admitted. We would monitor the supply and the needs for beds under HA and see how many patients we need to admit into the Asia World Center. From HK01, have you assessed why within 10 days the number of infections rose from more than 4,000 to more than 6,000? Are there any amber code confirmed cases which have spread the virus to their family members? And have you caught any amber code patients who tried to gate crash into some premises? Well, firstly, on your issue on the trend of the pandemic, in the past week, we have seen that compared to like in the middle of July to early August, the case loads back then. In the recent week, the speed of surge in the number of cases has increased. So within 2 weeks, the number might have increased by 1,000. But what we've seen right now is from last week onwards. From last week onwards, for a few days, each day the daily load increased by a few hundreds. That could be because of the subvariant BA.5, which has spread more quickly. In our samples, we've seen that the proportion of cases involving BA.5 rose from more than 10% to now more than 1/3 of the cases. So we expect that should this upward trend continue, then BA.5 could, in the coming weeks, exceed or make up more than half of the cases. The spread of BA.5 is really much more contagious than the Omicron virus. And also now is the summertime and schools are off, so people may have more activities in the community, and more people actually return to some sort of normal life, and they may be out more in restaurants or other crowded areas, and the chances of infection increased. So we will closely monitor the situation. And as for amber coat people, whether they have violated any laws in the sense of gate crashing, we would try to gather the data. For amber coat contacts, they are subject to medical surveillance. Should they enter premises that they should not go, then that will be a violation of the regulation. Same for people with the red coat, and we will take enforcement actions when necessary, particularly for the red coat confirmed cases. Should they leave the places of quarantine and enter the community, that would pose a risk of transmission to the community concerned. Next one, please. On the left-hand side, fourth row, lady in grey. I'm from Mingpao. For the Eastern District Fuhong Society Home, the staff member who developed an onset of disease on the 19th, the PCR test find that her viral load was quite high, and yet she had tested negative on her RAT test the day before. Is it that the RAT test results are not reliable? And also, would that be a problem with the reliability of the RAT test she used?
I'd like to know the number of staff members working on third floor. Did they eat meals together? Do they require quarantine? I'd like to know the vaccination rate. Because when was the last time when Fuhong Society Qingnan Jiga had cases? Because this morning we're told by a radio interview that the risk of local cases are higher than from imported cases, and so we can further relax our measures. Now, what is the point of requiring 3 days of quarantine? First, we are told that data for monitoring was required. What more data do you want? And when can you further relax the quarantine requirements? First, on the outbreak in premises of Fuhong Society, the PCR test was done on 19th, and the last day of duty was night shift of the 18th, and when he went off duty on the 19th, he did a PCR test as required. The CT value was 13, a low value with high viral load. And before he resumed duty on the 18th, he did an RAT that yielded positive negative result. Perhaps it's because he did the swab himself, and if he did not do it properly, there could be a false negative case. For PCR, it is more reliable. After all, the swab will be taken by a professional in a community testing center. So we do know that that sometimes happens. And as for the vaccination rate of that care home, those who have had one jab, 86%, 2 jabs, 84%, 3 jabs, only 66% of the residents, not very high. As for staff, our preliminary understanding is that all staff may wear masks when at work with all the infection control measures in place, and there was no mask of contact among staff. And this staff member did not live in the hostel. Now, because there's been an outbreak on this floor, and we have got 16 cases already, so all other residents are regarded as close contacts. What about staff members? We have not identified any close contact of staff because they always wear masks at work. So no staff member is considered a close contact yet, but we require them to do PCR for a few days, and then all residents have evacuated from the floor, so staff members do not have to attend this floor anymore. And as for further relaxation of quarantine measures, I believe the government will consider all relevant data. Now we are still in a rather serious situation. We have a rising number of local cases, and we have imported cases as well. We'll try our best to minimize the number of confirmed cases. For inbound travelers, they do have risks, so we require them to do more frequent PCR tests. And during the most risky days, they are quarantined. The purpose is to pick up most of the cases. Last question. I'm from HKET. A question about AWE. We are told that more complicated cases from Penny's Bay will be transferred to AWE. I'd like to know how complicated would they be before they qualify for transfer to AWE. And it appears that our AT results for staff of care homes have not been too accurate. So will you tighten the requirements and increase the frequency of PCR tests? Now, how many cases of violations do you have that are related to electronic wristband? Have they cut it or have they left home? And I'd like to know the utilization rate of equipment such as ventilators. I will take your first, second, and fourth questions first. AWE will receive some patients from Penny's Bay Community Isolation Center. Our experience is such that some patients have, because of their medical background, now some may be on a few types of medication, and they may require surveillance in drug. For instance, we have to monitor their blood sugar level. As a result, they may not be too suitable for Penny's Bay, but they are relatively stable. AWE will be suitable for this types of patients. Some were sent to ICC Northland Hospital previously. Now AWE will share the burden. For staff members, apart from RAT requirements, those who have to take care of high-risk patients, those organ transplant patients, cancer patients, patients on chemotherapy, etc. These staff members are required to do 2 extra PCR. We have extended the requirement to cover